For a party that preaches about healthcare services and providing the best of the best, the Alberta NDP sure aren't coming through on promises to provide people with better services. Instead, they're doing what they do best by throwing money at a problem which obviously never ends up in solutions. I don't like the public health care system. I think it's filled with waste. I don't think the majority of Albertans are receiving the care that they pay for or deserve. I don't like that employees are unionized and can easily be swayed to vote for destructive governments like the NDP because promises are made to make their jobs better. And contrary to popular belief, Canadian healthcare isn't free. It's actually way too expensive. Healthcare is the biggest line item in the Alberta budget, hands down at over $21 billion this year. That translates into 48%, almost half of all taxpayer money. We have the largest system in Canada and pay the most per capita, actually 33% more per capita above any other province with age-adjusted costs, sitting at over $5,000 per person. So you'd expect our system to be top-notch and amazing, right? Not so much. In a telling survey completed by Alberta Health Services employees, two major issues out of a bunch of questions struck me. Those were workplace satisfaction and quality of care. Now, for a government-run service where employees are typically paid well, you would expect positive responses. But you know, it's really bad when over 35% of actual Alberta Health Services employees identify as neutral, disagree, or strongly disagree that they would feel safe receiving care in the province's health system. That's over 1/3. And a combined 40% are neutral, disagree, or strongly disagree that they're satisfied with AHS as a place of work. Why would that be? These are good quality jobs. But this actually comes at no surprise when you really think about it, because it comes down to bad management. The NDP keep throwing money at AHS and they just keep squandering it away on management staff instead of desperately needed frontline workers like doctors, like nurses, techs, and other support staff that actually work to help patients rather than sitting behind a desk pushing paper. As demand for services increases, frontline employees are simply overworked, which leads to job dissatisfaction and which leads to not being able to deal with as many patients, and care suffers because they're always on the clock trying to rush through to the next patient. Instead of solving the problem of costly middle management bloat, I mentioned that the NDP just throw more money at Alberta Health. The budget actually increased by another 2%, which translates into millions of dollars, and they're also borrowing money for day-to-day operations. The Progressive Conservatives were no angels after Ralph Klein made cuts, and they just increased spending again as soon as they possibly could. But NDP spending is much more out of control. The system is absolutely terrible and they're not doing anything about it. Take, for example, this recent story about a man that contracted an infection during open heart surgery from faulty equipment, or the 23 weeks on average that people have to wait for medically necessary procedures and increasing ambulance wait times. You would expect for the amount of money we pay for services that these issues would be non-existent. Basically, Albertans are paying out the nose for care and experiencing, at the very least, more complications from health problems for being forced to wait in long lineups. What's more is that a lot of these unionized employees probably voted for the NDP on the premise of this whole concept of hope and change. I'd say it's the same old with this government, but it's worse. Minister of Health Sarah Hoffman admits that her government can't continue to increase spending on Alberta Health Services, yet they continue to do so while not addressing any of the rampant problems that come along with AHS. Instead of offering solutions like a mixed public and privatized healthcare system that would take people out of lineups and decrease wait times, they do nothing. With the NDP, it's always all talk, no action, and it shows in the way that they're handling Alberta Health Services for both patients and employees. For the Rebel.media, I'm Holly Nicholas. Thanks so much for watching. If you liked that video, don't forget to click the link to subscribe to our YouTube channel so that you never miss any of our latest videos.